Ventricular fibrillation, causes and symptoms. Ventricular fibrillation is a serious cardiac disturbance that causes abnormal heart rhythms. It can be fatal. For many people with this condition, irregular heart rhythms are the first and only sign of coronary artery disease. Ventricular fibrillation, or VFib, may be confused with atrial fibrillation or AFib. Both involve irregular heart rhythms, but they affect different parts of the heart. AFib can also signal a serious heart condition, but it is typically a symptom of a chronic problem, not a life-threatening feature in itself. Treatment. In emergency treatment, focus is on restoring blood flow as quickly as possible to the organs, including the brain. The patient may also receive treatment to minimize the risk of a recurrence. Emergency treatments may include cardiopulmonary resuscitation or CPR and use of a defibrillator. Cardiopulmonary resuscitation or CPR. Cardiopulmonary resuscitation or CPR aims to restore blood flow through the body. Anybody with some basic life support training can do it. In the past, CPR involved cycles of 30 chest compressions to the heart and then to mouth resuscitation breaths. Guidelines issued by the American Heart Association in 2008 suggest that breathing into a person's mouth may be unnecessary. Instead, the responder should deliver about 2 compressions per second, or between 100 and 120 per minute. The chest should be allowed to rise back between compressions. Once they have started, they should continue until either emergency personnel arrive or somebody comes with a portable defibrillator. Early CPR and the use of a defibrillator increases the person's chance of survival. Using a defibrillator. A defibrillator can be used together with cardiopulmonary resuscitation. The device sends electric shocks across the patient's chest. The aim is to shock the heart back into normal activity. The shock may initially stop the heartbeat, but it can also stop chaotic rhythms and restore normal function. A public use defibrillator can be used by a lay person. These devices often have voice instructions on their use. A public use defibrillator is programmed to detect ventricular fibrillation and emit a shock at the right moment. In many countries, public use portable defibrillators are available in public places such as airports, major train and bus stations, shopping malls, community centers, places where elderly people gather, casinos, and so on. Causes. When the human heart beats, electrical impulses that trigger a contraction need to follow a specific route to the heart. If there is something wrong with the path of these impulses, arrhythmia or irregular heartbeat may occur. When the muscles in the 4 chambers of the heart tighten, a heartbeat occurs. During a heartbeat, a chamber closes and pushes blood out. During a heartbeat, the muscular atria or smaller upper chambers contract and fill the relaxed ventricles with blood. The contraction begins when the sinus node, a small group of cells in the right atrium, emits an electrical impulse which makes the right and left atria contract. The electrical impulse continues to the center of the heart, to the atrioventricular node. This node is located on the pathway between the atria and the ventricles. From the atrioventricular node, the impulse travels through the ventricles, making them contract. As a result, blood is pumped out of the heart and into the body. Symptoms. The most common signs of ventricular fibrillation are sudden collapse of fainting because the muscles and brain have stopped receiving blood from the heart. About an hour before ventricular fibrillation, some people experience dizziness, nausea, pain in the chest, tachycardia, or accelerated heartbeat and palpitations. Ventricular fibrillation and atrial fibrillation. Which is more serious? Ventricular fibrillation is more serious than atrial fibrillation. Ventricular fibrillation frequently results in loss of consciousness and death. Because ventricular arrhythmias are more likely to interrupt the pumping of blood or undermine the heart's ability to supply the body with oxygen-rich blood. Ventricular fibrillation can cause sudden cardiac death or SCD. Sudden cardiac death accounts for about 3 lakh deaths annually in the United States. Sudden cardiac death can kill a victim in minutes, and it can occur even in people who seem healthy. Risk factors. The following risk factors are linked to ventricular fibrillation: previous ventricular fibrillation, a previous heart attack, cardiomyopathy, a disease of the heart muscle or myocardium, cocaine or methamphetamine use, congenital heart disease or being born with a heart defect, electrocution or other injuries that cause heart muscle damage. Heart attack is the most common cause of ventricular fibrillation. Diagnosis. Diagnosis of ventricular fibrillation usually happens in emergency circumstances because the patient has lost consciousness. The following diagnostic tools can confirm ventricular fibrillation. A heart monitor. This device reads the electrical impulses that cause the heart to beat and will detect either no heartbeat or an erratic one. Checking the pulse. The pulse will be difficult to detect. It may either be very weak or absent. Diagnostic tests can help to find out what caused the ventricular fibrillation. Electrocardiogram or ECG, cardiac enzyme test, chest X-ray, nuclear scan, echocardiogram, angiogram or coronary catheterization, MRI or CT scan. Prevention. If a physician determines that the ventricular fibrillation results from scar tissue due to a heart attack or some structural defect in the heart, medications and medical procedures may be recommended to minimize the risk of ventricular fibrillation happening again.